Meningitis is an inflammation of the membranes that surround your brain and spinal cord. The disease inflames the protective tissues around the brain, which are known as meninges. Bacterial meningitis is a bacteria-caused case of meningitis and is the most toxic branch of the disease. There are over 50 different meningitis-causing bacteria. 5 of the most common bacteria are Streptococcus pneumoniae, also known as pneumococcus, Group B Streptococcus, Neisseria meningitidis, also known as meningococcus, Haemophilus influenzae, or HIB, and Listeria monocytogenes. The disease is spread through coughing, kissing, and sneezing. But not all bacteria that cause meningitis are spread from one person to another. Meningitis-causing bacteria are actually less contagious than viruses that cause the common cold or flu. You can also develop bacterial meningitis after eating certain foods containing that Listeria bacterium, such as meat, seafood, and dairy. Your body is especially susceptible to the disease after infection, when immune system is weakened, or after a head trauma, when meninges can be torn. The bacteria that cause meningitis can live in your body and the environment around you and are often harmless. The danger is when bacteria get into the bloodstream, which can be from the sinuses, ears, or other part of the upper respiratory tract. The bacteria then travel through the bloodstream and spinal cord to start an infection, causing the tissues around the brain to swell. Immediate symptoms from bacterial meningitis include fever, headache, and stiff neck, confusion, nausea, vomiting, photophobia, the increased sensitivity to light, sometimes a skin rash of purple discoloration, and difficulty waking or drowsiness. Within hours, symptoms can escalate to coma, paralysis, and seizures. If treated directly when detected, recovery from meningitis can be full. However, common long-term effects from the disease include brain damage, hearing loss, learning disabilities, impaired vision, and even death. Your doctor will prescribe you antibiotics when meningitis is diagnosed. Start on antibiotics immediately, or there is more likelihood of permanent brain damage or death. Thanks to vaccines, bacterial meningitis is not very common. An outbreak of meningitis occurs about once every 10 to 15 years in Canada, and on average there are more than 1,000 cases each year. But for people who do obtain the disease, there's a death rate of 10%. Keeping up healthy habits can help in preventing this disease. Keeping your immune system strong helps the body fight against harmful bacteria. There are vaccines against the 3 most common meningitis-causing bacteria. So get your vaccines to help prevent bacterial meningitis.